So, as much as I hate to be doing a segment on this topic, as I read the reports and I read about the most recent updates, I felt like I had to, because we're once again in a spot where we've got to talk about it. So, we're looking at this Delta variant. You've probably heard about the surge of this Delta variant. The World Health Organization now expects that it represents about 60% of the cases in the U.S. right now. It's quickly becoming the dominant global strain. And so this presents a lot of problems because our vaccines weren't exactly created to defend against the Delta variant quite as well. Although the vaccines are extremely effective, we're still looking at a problematic response because, and there's one key reason why that I'll get into in a little bit here, but first, for context, from an ABC News release, about 50% of Americans got vaccinated before numbers fell to where they were before there was enough supply. So the vaccine response has slowed dramatically. We have not gotten to the herd immunity sort of threshold that we were going for, which is closer to like 70 to 80% of the country. We just have about 50. And a lot of that has to do with folks that are spreading misinformation, people who are very hesitant about the vaccine, and not a lot of it actually has a lot to do with accessing the vaccine anymore. There still are some cases where folks are having trouble, but by and large, people have access to it. You can go to a drugstore, you can go to most local places and be able to find a vaccine. Even in rural communities, there's been support with folks actually going door to door to give people the opportunity to get a vaccine right in their home. So the vaccine response has been really innovative in the United States. But the issue here is that only about 25.8% of the world has received at least one dose, which is pretty rough. When you really break that down on a global scale, the big issue here is that where the virus is let run free, it produces a bunch of new variants. And then those new variants can easily make their way across borders, and viruses don't care about what country you're in. They don't care about where the border of one country is and where the next one is. They just spread. And so, for as long as the globe is focusing on and dealing with a coronavirus epidemic and pandemic, it's always going to be coming back and affecting us. So there's already tons and tons of new strains that we're going to have to process and deal with. Vaccines will probably have to spend some time updating to cover new variants that may be more dangerous, more easily spread. And the question that we get to is, why is this happening? And I'll tell you one of the main reasons. I mean, some of it is just this is a pandemic, and there's only so much we can do, to actually respond to this. But what we're looking at is during this pandemic, especially when vaccines became available, wealthier countries prioritized themselves, buying up all the supply, even more, much more actually than they needed, without understanding that the global insecurity is going to be caused by lack of supply in lots of places. So what we really needed to do is have a response that prioritized getting global access to the vaccine, so that countries all around the world of all shapes and sizes could begin to get the vaccine, and that we could get the vaccination process underway and the infrastructure around that underway in lots of countries. Instead, countries like the US just bought up massive amounts of supply and have hoarded lots of vaccine supply in their own borders, and protested against patent. Basically, they were going to alleviate patents so that generic versions of the vaccines could be more easily produced in some countries that couldn't afford to pay for our vaccines. And these wealthier countries wanted to move to stop it. And the issue is, all that does is it protects the profits of pharmaceutical companies, but it doesn't protect the planet from a global pandemic. And so we look here once again, the pattern remains where we see wealthier countries continue to protect the wealth of their own private entities that exist within their borders. And the lobbyists from the pharmaceutical industry are so strong and have so much influence that they can pretty much unilaterally shape policy to hurt regular people just so that a business can continue to maintain a profit margin. So thankfully, the Biden administration did somewhat come to something a little bit more reasonable after a while. They did start to kind of focus a little bit more on helping the global reaction to the pandemic through spreading vaccine supply. But the numbers just are not nearly enough. There was, at one point, Biden was posting things on his social media about how we just sent 80 vaccines. It's like, that's just silly. I mean, that's just not 80 vaccines. What is that? And so, this also gets back into our domestic response. With the advent of the Delta variant becoming so widely popular, there's a problem here because we've already pretty much lifted any semblance of a masking policy from a country standpoint. There are definitely individual places that are still trying to use masking policies, but by basically, just letting it go to the honor system, what's ended up taking place is that people just aren't doing it at all anymore. And in some cases, they're having super spreader events with lots of high concentrations of unvaccinated people, which is then producing an issue because, you're spreading this Delta variant across the very people who are most likely to be susceptible to it. And so, once again, I'm going to make the case that if you haven't already, there's still plenty of time. You can still definitely get a vaccine, and you definitely should, because if you're able to, it's really going to help. We're still constantly getting new data about it, but it's a very safe vaccine. If your doctor specifically tells you that you can't, then sure, listen to them. But other than those kinds of very fringe cases, this is a highly effective vaccine, and the more people that get it, the better off that we all are. We're already seeing places like Los Angeles County starting to have conversations. They're already reinstating their mask mandate, and so they're seeing numbers that are high enough that are concerning again, because these numbers are similar to what we were seeing at the beginning of the pandemic. So, I don't say this to make us all feel bad. But that's just kind of the effect that this kind of news has. So, hopefully, we can continue to coordinate a better global response, and hopefully, people can come before profits in yet another area of our political future.